Hello, hello. Good afternoon, and welcome to another live show of Conversations with Cole. Today's topic, get it together, we get it together. welcome to another welcome to another sessions of Conversations with Cole. Today's topic will be mental health, depression, and self-care. How do we get through those? How do we manage that? How do we get through that? Um, Today I have with me Jakesha as one of my co-hosts and Tanisa co-host. And I also have with me Virginia Eldridge, and she is going to be she is calling right now. And I guess if we have any questions about what it is we are discussing, because she just wanted me to have a conversation, and I will allow her to introduce herself, and we will take it from there. So let me make sure I have Virginia. Okay. So, Virginia, if you would introduce yourself and your credentials, and just, I guess if you could just touch on, not even touch on it, but our topic today is mental health, depression, and self care. And per our conversation, we're just gonna have a conversation. This is not a session, but we're gonna have a conversation, and you will be here to guide us, um, and give us a little bit of insight where we need to have some insight. So if you would like to introduce yourself to the Conversations with Code audience.
My
um,
name is Virginia Eldridge. I am a licensed professional counselor. I am pretty much a therapist. I am a therapist. I work with mental and behavioral health. I specialize in depression, anxiety, stress management, time management, grief, and working with people who are dealing with co-occurring disorders, which include those things, including substance use or abuse.
okay, so we're gonna just kind of dive right into the conversation, and I think with this conversation, for me was, I mean, I guess it could be kind of heavy. It just depends on where you are in life. So for me, again, and I probably say this every time I get on, the goal for me is to always, um, the goal is that I hope, and my prayer is that no matter what our conversation is, that even if it helps one person, that's the goal. So I'll start with just discussing the whole. We'll start with depression, which it all goes hand in hand. So, um, and I think the topic came up for me. This was actually one of my topics. However, I guess maybe the last couple of weeks, my daughter and I were having a conversation. And I think with depression, it's one of those things that where you never, or you may not even understand that you are actually in that state of depression, because you're so busy moving around and doing the things that you normally do, that you you don't realize it until maybe you stop and you take a breath and like, okay, or you have a
That
conversation with someone, and then they kind of help you see where you are in the moment. And I also believe, just with the topic, I believe because there's so much going on in the world, we're it's an overabundance of things and reasons why we can fall into that state, I mean, it doesn't take a lot sometimes, but there's so many reasons we're in a world where it's all about making impressions. You know, you have to look a certain way. You have to be in a certain space in life, or you have to um, you dress a certain way. Your body looks a certain way. There are so many things that can put so much pressure on an individual that you sometimes you don't even realize that it is pressure. And then
Well,
once you
let's.
realize it, go ahead. I'm sorry. Go ahead.
Well, before you got too far, what I wanted to say was one of the reasons a lot of people don't know that they are in a depressive state or dealing with depressive things is because it's not what it's supposed to, according to the stigma, what depression looks like.
Yes.
See, depression doesn't look like just being sad or laying around the house or, struggling. It doesn't look like that only.
Right.
It can also look like overworking, avoiding things. It can look like the things that you do every single day.
Right. Right. And then I think too, sometimes even as I was thinking about this, and I was thinking about how we have put a well, I don't I know in the maybe I'll say in the black community. I can't speak for all communities, but I do know that we put a we used to I believe we're getting so much better. We would put a label like that everybody has someone in their family that is crazy. Use that term. And you look at that person and you're like, oh well, that's what we expect, or that person, is on medication or that. So you focus on that particular situation when you have other people really suffering in silence and they don't talk about what's going on in their lives or what may or the issues that they may be having because there used to be and I say used to be because I feel like we are coming we are moving, progressing when it comes to speaking about mental health, or even with us, even speaking to a counselor or having a conversation with someone outside of your friends, discussing what may be going on in your life. And sometimes it's hard because you feel like you have it all together. And even with me, because I had a counselor this year, and it helped me tremendously in ways that I didn't even realize that I needed to speak to someone. So, um, I like I said, I think we have come. We're making steps. However, I also believe that we're still in a state of denial when it comes to depression, depending on where you are in your life. So I wanted to at the beginning I said that I had this conversation with my daughter Keisha, and once we once we spoke and talked through some of the things that she was feeling, she felt she had her own feelings about depression or just how she was feeling in that moment. So I would like for her to just kind of go over the conversation or just how she was feeling in that moment and just some of the things that she may feel like helped her, or even if she just said something that may resonate with someone else. Um, she wanted to be here today. It's not that I'm her mother and I forced her, but no, she wanted to be here today because she felt like this was a needed conversation. And young people, I don't, maybe they have a difficult time, or maybe they don't recognize depression, or maybe they don't recognize that what they're going through is a mental breakdown. So, um, Jakesha, if you would like to.
Um, well, so it was just I was just overwhelmed and didn't realize that I was overwhelmed until I started having panic attacks. And it's just a lot because it's just a lot going on. I have a lot of things going on, a lot of things that I'm trying to do, but like with my mind, I just be racing, like I be all over the place. So I know it becomes overwhelming because you're thinking about so much at one time. So, um, it was just kind of where I'm trying to move. Just things about business. Just life, basically, really.
Right.
And
So, so let me give you a little bit of the conversation that we had. It was basically like she said, she had a lot going on, with moving and making decisions, and I'm not even saying that now at this state, being, how we put a time limit on where we're supposed to be and what we should be doing in our lives at a certain period. I think in the beginning, and maybe not so much when we had the conversation, that's pressure right there, because the world tells you that by the time you get to be a certain age, you should be in a certain space, or you shouldn't be living with your mother, or you shouldn't be doing this, and so she is transitioning into her 30s. Well, she'll be 30. And so for her, it was, I should be doing this, I should be doing that. And I know that's where some of the pressure came from, and she puts a lot of pressure on herself. But but with the conversation, it it when we finished having the conversation, she said maybe I was depressed, because after we talked, I felt so much better, because she was holding all of those things in, and holding those things in, whether you realize it or not. Exactly.
yeah,
And it
definitely
causes you
did.
it causes you to put yourself in a mode, in a stressful situation. And the thing about it is, how do we manage our lives without becoming so overwhelmed and so consumed with what's going on? You still have to live your
Balance.
life you still have to go through a daily routine, but how do we manage that?
Balance.
Yes.
So the human body, mind, we are set up to seek balance. The pressures of the world puts on you all these other things. We fear judgment. You know, we fear, what, social media puts this out there, and the pressures from, our culture, and what we grew up, thinking it's supposed to look like versus what it actually looks like.
Right.
We also avoid for those very same reasons. But our body automatically wants to seek balance. You asked about how do we manage these things? Balance.
Right. So,
Everything out there has a counter. Everything has a counter. There's nothing that does not have a counter. Hot water, cold water. That's how you get that middle ground. Your right side, your left side.
So it's just really about trying to find that balance and
Mm-hmm.
coping with life, but then
Mm-hmm.
also trying to see what word I'm trying to say. Also being transparent enough to look for the help and look for ways of having balance. Because depending on how some of us was raised, I know I can say with me, very strong father, military. You do this, you roll like this, and then when the different wiles of life come up on you and you embark by it, it's like, okay, how do I handle this and still gotta wake up and smell the coffee and go to work, and then go to work with a smile on my face and helping people with their issues when you still in the back of your mind trying to figure out how you gonna handle all the things that you gotta handle and make it look easy because
Hmm.
that's what we were taught, you know.
And it is unfortunate that we are living in a time where, or we were raised in a time and in a culture where talking about these things made you appear weak,
Mm-hmm.
appear, in quotations, crazy, or to not have it all together.
Mm-hmm.
That's the that's what we're trying to transition from. And in that transition, we must struggle in order to blossom.
Right.
So when we talk about people trying to push through, that's not what we want to do. Pushing through is not healthy. We want to work through the things that are going on to get to the other side. Life is going to give you ups and downs. Managing those ups and downs with healthy coping skills. Having a safe place to talk about what you're dealing with and what you're going through
Mm-hmm.
Yeah.
So Virginia, can
without
you
judgment,
give
without fear of judgment,
Mm-hmm.
seeking help when needed. We have to start thinking about our mental health in the same fashion as we think about our vision, our dental, our annual, visits. We get skin lesions. We want to seek out the dermatologist. We want to think of our mental health in the same fashion. It's an appointment. It's another doctor's appointment in order to keep me well.
right.
You have to start making that a part of your wellness routine. We have to start examining and questioning ourselves
Yes.
because that's the thing we fear most. See, we have so much stuff that the world puts on us, but we don't look at the stuff that we put on ourselves. So if you have an honest conversation and really look at yourself in the mirror, like really take a real hard look at it,
Yeah.
it's a lot of things. We got some good, some bad, and some ugly. When I talk about that ugly stuff, I'm talking about that stuff that we hide from ourselves. That's the stuff that's taking up about a third of your daily cup.
That's for sure. Because I know with me myself, I have trained myself to, like, I feel like I have one side of my brain still going through all the grief and stress and things that I put on myself on how I should look, how I should walk, how I should talk in this part of my life, like how we spoke about it earlier. And then my other side of my brain is the things that I know I have to get up to do to function through the day, to take care of, which is go to work, do what I need to do to make my job, a better place. And I find myself even talking to the people. And then when I talk to certain people at work, or try to work through them with certain things, it makes me identify with some of the hangups that I have for myself. But then at the same time, you're still trying to juggle all that, and then you just get to a point you just like, okay. So like Keisha said, then you get overwhelmed. So I
Mm-hmm.
think the thing of it is in our communities, we really have to get to the place where when we feel that overwhelmness, that it's okay to talk about it.
Yeah.
Find somebody to talk
Yeah.
about it. Sometimes
Well, let's not even get to that place. How about we are able to manage before we get overwhelmed? See, that's not what we want. That's
yeah,
not healthy.
and it's
We
not.
don't want you to get overwhelmed. What
Right,
we need to do is be able to focus on self while doing all the other things.
right,
Where
Right.
on your to-do list
Right.
have you put yourself?
Right. Right.
Where to your to-do list have you had a conversation with yourself and prepared yourself first thing in the morning to be able to deal with what you can
Yes.
and let go of what you can't?
Yes. Yes.
I think
See,
that's the thing.
that's
That's
that
the key word,
balance.
the letting go, the balance. I think sometimes, and I can speak for myself too. Sometimes we just get to a place where I think we didn't harbor that mess for so long. It feel like we should still hold on to it, or I don't know. It's like it's real crazy. I know when you said that, that really hit home right there for me as well too.
And I
To
But
figure
I
out
think
how to
when
place
I say
things
let
and let
go,
go of those things that we can't do nothing about, like you say.
but when I say let go, I think See, we have to figure out what those terms mean for us. So, in your term of letting go may mean one thing and mine's may be another. And defining those things for self, again, talking and having a conversation with yourself. So when I say let go, what I mean by is physically looking at your to-do list, handling what you can today, and moving that other stuff over there.
Yes.
And not harboring on what I did or didn't get taken care of today. I'm not talking about letting go of your trauma or your grief or your pain. I'm not talking about letting go of any of that, because those things you carry with you. It's women that we're talking to right now. See, sometimes we have to shift. Any of you women carry purses?
Mm-hmm.
How often when we carry a purse, it get heavy on your right side? What we do to?
Shift it to the other side.
We shift it. The problem is we never take nothing out of it.
Right, because even
We
when
never
transfer,
unload
we
it.
put the same stuff that was in another person to the next
And
person.
Sucking it out and putting it right back in that other purse.
We sure
However,
do.
there are some things in that purse that you're carrying that is not
Mhm.
relevant right now.
Right.
All right.
So when we learn to
Amen.
check, when we learn to check our stuff every day, when we learn to examine what do I need today? Because the stuff that you needed yesterday may not be relevant today.
Yes, exactly.
But we're carrying it on into the next day because it was on our list of things to do.
Mm-hmm.
No,
Mm-hmm.
it might not even be relevant. I don't know how many times I have had to clean out 85,000 receipts out of my purse.
I know, right?
Right.
I know.
Ain't none of that relevant today. I ain't taking none of it back.
Right. And I think
So,
what you're saying is, and what you said at the beginning, is really about balance, and I feel like you said, it really is self inventory every single day.
every day.
And I find myself in that place to where I start that, and I may be good on it for 3-4 months, and then I stop. Right now I'm in the place to where I am. It is about self inventory for me.
You have a pen and a piece of paper in front of you?
I do.
Write this down.
Yeah. Okay.
Things not done on purpose or easily forgotten. What do you think I mean by that?
So to me, what that says is, if you don't do it regularly, then you're not going to think about it. So
On purpose.
right. So
And that's you.
if I don't purposely get up every day and do what it is I know that I choose to do, then I forget about doing it.
And who's the first to go off that list?
I am.
Always.
I am.
Because we do it sporadically.
Yes.
We do it every now and then.
Yeah.
We don't make it a consistent everyday thing. We get up with purpose and go to work. The purpose is to survive.
Right.
But if you don't take care of you, you can't go to work.
You cannot.
Because if you don't take care of you and your body and your mind, guess what it's going to do? It's going to take what it needs anyway.
Right.
Anyway, it's going to take it. It's going to automatically take from another place. Sometimes when your mental doesn't get what it needs, your brain, remember? Your brain.
Yeah.
Mental is your brain. When your brain don't get enough oxygen, it don't get enough blood flow. When it does not get enough nurturing and caring, it take it from other places. Your body does it too. You don't get enough calcium, it take it from your teeth. You don't get enough rest, it shows up on your face and your skin. And you don't drink enough water, it will show up.
Right.
So when you thinking, Keisha, that you are getting things done, handling it, on the move, getting it done. Yeah, you are. You get all those things done while neglecting self.
Right.
And that's why now, like, I try to basically just tell myself, what do you have to do today do what you have to do today and don't worry about tomorrow. And like you said yesterday, because yesterday you bringing into today is yesterday might have been very overwhelming and today might be an easier day for me, but when I carry yesterday into today, it becomes overwhelming again, so I'm definitely trying to tell myself every single day what happened yesterday, that was the past. Today, let's start over. You got a fresh, clean slate. Just do what you have to do and take care of that. So,
Well, I want you to, you can do just that. But I want you to think of it and reframe it, add to it. At the very beginning of your day, ask yourself, Keisha, what do you need? What do you need right now in this moment? And I need you to ask yourself several times throughout the day. You have to do regular self checks because if you don't get what you need, you can't do that other stuff. So throughout the day, it's what do I need this morning? Because simply think about it like this. We talk about those terms that are used every single day in our lives. Waking up on the wrong side of the bed. Everybody heard that term, right? Sometimes that means I should have slept in a little longer. I didn't get restful sleep. Sometimes that means I skipped breakfast. Sometimes that you do you get where I'm going with this?
Yes.
Yeah.
So if we wake up and first, because when we wake up on the wrong side of the bed, that means that the cup that we have for today, which has 24 hours in it, sometimes we have already filled that. We have taken away 5 hours of it. So now we already, you know what I'm saying? We already over capacity. And we ain't even started dealing with the day.
Right. And I think and the key thing is really self-care and self-inventory. And I understand what you were saying when you said it's not about really, and you didn't say it in this term, but teaching us how to sit and go have a conversation with, whether it's a therapist or a counselor or a psychiatrist, whatever it is. The goal is to do self-inventory and take care of yourself to where you don't necessarily even get to that place to where you, or even where you have to go there, where you have to be in a mode of having a conversation about how awful things are, how hard life is. Because when you do self-inventory every day, now you are checking off your own list and reevaluating your own self and reevaluating your own day. So
Yes
all
and
that
no.
is self.
Yes,
Is self.
yes and no.
No.
Yes and no. Not no. Yes and no.
No.
How often do we tell ourselves, I just need to be around some good people?
Often.
Okay. So you seek out that thing that you need, not just to talk about the bad stuff, but there are things that happen that are sometimes beyond our control, and we need to be able to be able to live with that.
For sure.
And also seek out those other things. Because sometimes, again, self-inventory, we go back to the beginning. Self is first. It has to be automatic that you talk to yourself like you brush your teeth. It has to be automatic. How many times you left home without brushing your teeth in the morning and get in the car and be like, oh, snap. Oh, no, I just did that, huh? It was just me. Ain't nobody else ever ran out the house at night. Ain't nobody else ever did. It was just me. Oh, okay. That's fine. That's fine.
We get
Big
And ran to the store.
Big
Uh-huh.
times.
We definitely understand that right
Oh,
there.
okay. You get what I'm saying real quick. You like, shit, I wasn't running nowhere real quick. Oh, I'm sorry, y'all. But still. but that's what I'm saying. We have to be able to just be real, right, wrong with yourself first. You're not going to be able to be real and honest and with nobody if you ain't that way with yourself first.
True.
We think we are.
True.
We think we're doing, that thing that we're taking care of ourselves because we want to get our nails done and get our hair done and our house clean and, but we really not looking on the inside because sometimes what you want is not what you need.
Yeah.
Yeah, because, like, sometimes when you having a conversation with other people, you be like, dang, I just gave her all that advice. Why I'm not taking it myself? You know, like,
Yeah, exactly.
I got to call somebody else to get that same advice that I just gave out. So,
Right. Right.
yeah, it's definitely a challenge. It is.
It's easy to tell somebody else what to do,
Yeah.
as opposed to sometimes doing it on
Following it. Yeah.
doing it your
I mean,
own self and following your own lead. Sometimes you have to. I don't
that's
know.
not what you're taught.
Yeah. Right.
That's not what you're taught. You're taught to do unto others as you would have them do unto you.
Hmm.
That's what we're taught because that's what it says. However, I don't care what you do, you got to teach people how to treat you. And that starts by you
Yeah.
treating you how you need to be treated.
Yeah.
Yeah.
And so if you're not treating yourself with love, respect,
Hmm.
compassion, empathy, if you're not having patience with yourself and all of those things, then really, if you're being honest with yourself, am I really able to give it to somebody else?
Because it's definitely a mirror reflection. So
Hmm.
what you give out is what you definitely gonna get back. You
Hmm.
know. So if, like you said, if you don't have that same love for yourself, how do you expect to receive that same love? And I think so. What right now, what we're really talking about is the self health care of all of this, which will keep you from the other stages if you can really resonate those things in your life. You know, putting yourself first, balancing your life, and doing a self inventory of yourself. I think that those things will keep you from the other stages of life. However,
Yes and no. See, yes and no. It's not an either or in life. Life does not come with one or the other. See, there you go. See,
right. So
life don't. That,
no, and so
uh-huh.
what I'm saying is, it's not that I'm not saying that what I was saying was the goal is not to get to the place to where you have to where you have all those the mental part of it. You want to do the other part. However, when you're in that space already, you we know what we should do to help get from that place, or
Mm-hmm.
really almost to prevent us from getting to that place. However, when you're in that place, it's not it's not as simple to the
Oh no,
person that's in that place, because for
absolutely.
me, I never realized that I even was in a place of feeling depressed or feeling lost or feeling just overwhelmed, because I am one of those people where I feel like if I can't fix it for Nicole, can't nobody else fix it for me. So
Mm-hmm.
I am that person, and I pass
Mm-hmm.
that along to my daughters, and
Mm-hmm.
and it's from watching me. And so the place I am in now, I'm in a space to where I want to allow other people in and be able to help me and be able to help me reassess some things when I don't know how. That's like even when I'll use the example for when Qtopia closed. When Qtopia closed, I never found myself in a space to where I felt like I was sad or hurt or angry or any of that, because when it was done for me, it was done. And that's kind of how I typically do things. When it's done, it's done. However,
Mm-hmm.
I found myself on one day, I found myself so overwhelmed, and all I could do was stay in the bed and cry all
Mm-hmm.
day. And my grandmother had just passed, so now I'm dealing with that. And then I'm
Mm-hmm.
dealing with the fact that, man, my business is gone. A business that was great, a business that was great to the community, a business that people love, a business that I love, until I allowed it to put me in a stressful space. So once I got to that place, all I could do was cry about it. And then I realized I that I never dealt with that. It was just like, it's gone, move on. But I never dealt with the fact that I really did lose something great. Now, am I sitting in it? Am I am I just allowing it to manifest in my life like, oh, I can't move forward? No. But I had that one moment to where I really had to realize that maybe I am sad about this. Maybe I am bothered by it. But once I realized that I was in that moment, I knew how to, at some point, I knew how to get myself out of that. However, what about people who don't know how to get themselves out of it, or mentally, or not prepared, or mentally they don't know how to even if it's just talking yourself through a situation. That's
where
the part right there.
Right.
So having people around you, and so Nicole, I'm gonna bring this up because although I'm a professional, I've known you beyond the profession. You get what I'm saying? I didn't meet you through my profession.
Right.
And so, do you remember a conversation you and I had?
Which one?
A while, which one? A while back, we were talking about mental health and getting help and showing your daughters a new way of what it could look like.
Right.
Okay.
Right.
And so, having people around you, having real, genuine people around you that will beyond what it looks like, will ask you, are you okay? Because you're not acting like you're not acting like yourself.
Right.
Having people that will question you, and not in a way where, and you may avoid it. You may even feel like, but having those genuine people in your life that will simply say, are you okay? You know, we have to stop allowing things that don't look right to be okay. Because silence is acceptance. We cannot, if I care about you in any shape, form, or fashion, there's no way I can see you struggling in that capacity without saying, hey, what's going on?
Right.
You know, we have to not be fearful of rejection when someone, because it's not about our opinions of what they're dealing with. It's not about giving them advice. It's about sometimes genuinely just asking a question. And again, when you don't know, sometimes you just don't know that you're dealing with it, because again, it can simply look like to the rest of the world that you got it together. You can look like you got it together.
And that part right there, that's it. And I feel like we walk around, and not that and I don't think it's that we walk around and want people to assume that we have it all together. Sometimes it's just how we carry ourselves. It's just where we come from. It's just how we have been molded, or either by how you were raised, or molded by society, or whatever. You're in that space. And Tanisa can tell you, people can ask me if I'm okay. And if you ask me if I'm okay, depending on the place that I'm in, I'm never going to tell you that I'm not okay. And it's not because, it's because I am that person. Like I said, I really have gotten so much better that if I'm not okay, unless I know you can immediately help me in some kind of way, whether it's, or feel. It's not that you can't, I have to feel that, okay, what you say is going to help me, or what you do is going to help me. If I feel like I can't get that from you, I'm okay. I don't want to talk about it. I don't want you to keep asking me about it. I don't want you to do any of that, because
but the people that care about you will.
Yeah.
Whether you talk about it or not, the people that care about you, that you have around you, that understand and know you, will say, okay, you're not acting like yourself. Something's going on. I know you're not talking about it because that's who you are, but I need to let you know that it's showing up. And it's showing up like this, it's showing up like this, and it's showing up like this. I see you. And I understand, but our bodies want that immediate gratification. And sometimes it's not about gratification. It's not about simply resolve. It's just not about the resolve. Because some of our struggles, nobody can help us through but ourselves.
Right.
And so that's that avoiding tactic, or that what we say, that fear of judgment comes up, or we distract ourselves with this, or we overlook that and we think we can get over it or go under it, when the only way that we can actually work it out is to go through it.
Right.
The struggle is where you find your strength. See, we fear working through some of those things because we are unable to see, as you said, the thing at the end of it. Sometimes you can't see that light that's down there, because by talking to somebody, or by, letting it go right now and picking it up later. We have so much. Sometimes we just set it down and don't deal with it.
Right.
So
Sometimes we just set it down and don't deal with it. And there are ways. Again, I'm going to give you a couple of tips on basic ways to just manage daily. Number one, self-inventory. Put you on your to-do list. What that looks like, it could be simply 5 minutes of just simply breathing. It could be asking yourself what you need, making sure that you're taking care of your basic needs. Am I rested? And do I feel safe? Do I feel secure? What, do I need to eat? Making sure that you're taking care of those basic needs will help you, because I don't know how many times I've skipped a meal because I'm too busy to get to it. So you have to make sure that you're taking care of your basic needs. Secondly, find you somebody that you can trust to lay it down without asking for somebody without them feeling the need to fix it, without them feeling the need, to one up it, without having them, I just need to lay this down for a minute. I'll pick it up again tomorrow.
Yeah. That right there, that's it right there. Even because a lot of times you can talk to people, and you really, all you want to do is be able to say, this is what's going on. I don't want you to fix it. I just want you to listen to what I'm saying. That's great advice right there. I think
And that's because sometimes the noise is so loud in the front of us that we can't really get to work through the other stuff, because the stuff that we quiet our minds to is behind it. And so sometimes we don't even want to talk about what's up there, because that's the noise up front drowns out what we really need to work on. And sometimes we ain't ready for that.
Yeah.
But if we daily, on a regular basis, check in with ourselves, eventually we will get to a space. But I'm going to tell y'all straight up, everybody needs to find them a therapist. Find you one. Get you one. You don't have to go to a therapist because you're depressed.
Yeah.
You don't have to go to a therapist. Sometimes you need regular maintenance like your car do. Don't put no oil in your car and watch what happens. It's going to clunk out on you.
Now,
okay.
Just like you told when we talked about this, and Virginia is the one who actually referred me to the therapist that I talked to, and what she said to me prior to me even talking to the therapist was, once I start to change, then it was my daughters will change, because those are the closest people to me in this moment. They will start to change because.
So the quote was, change requires change.
Right.
Once you start to change the way you are and the way you involve yourself, the people, places, and things around you will start to change. Yeah, the way you look at things will change. The way people interact with you will change. And so that's what change requires change. Yes. And sometimes that change means they stop coming around.
Yes. Yeah. That's it. I think, Tanisha, did you have a question? Or you were going to say, she was going to say something. She was going to add. Or
I guess my question, I was trying to get some pointers, but you end up kind of giving a little self-check too on I know it's so many different forms and different levels of where we can be at mentally. So, like for us, ones that feel like we're so strong and we're getting up and we're going through our day and we have all the answers, so we think, but we still find ourselves in a bogged down, way once you get home and take all the other stuff off. Then, you know what I'm saying, you still got to deal with, what has overwhelmed you or certain things. So the therapist part, I know that is true, but just on a daily, because you just have some of us out here that just feel like they're coasting through. They get up, they get dressed, they go to work. We know how to do all this. If we still have children at home, we know how to feed them, do this. All our daily chores and our daily habits of life that we have put on for ourselves to maintain our life, as you say, and to keep going. But then at the end of the day, when it's time to go home and woosah, then like you say, we look into that mirror, and sometimes the heaviness can be so overwhelming at that moment, and the anxiety and everything sets in. So you have some people that are self-medicate, drink, whatever, or you have some of us that'll just go out and party and party and party and party. But at the end of the day, when you come back home to all that you have, so
Without
us,
unpacking,
exactly.
any of this, and that's why when I talked to Nicole about doing this, I said it would be just a basic conversation.
Right.
Because without knowing in the position where I am, what I'm going to tell you, what I'm going to suggest for all of you, again, find you a therapist. I can say this all day long, but that therapist does not always look like calling the mental health number on the back of your phone.
Right.
Sometimes it looks like a place where you can just lay down, again, those burdens. You have to be able to get in depth sometimes with, right now, I just can't deal with this because you're not strong enough. Right. And again, first and foremost, it starts with an honest conversation. When you get home and you strip off all that stuff and you are looking in the mirror, sometimes people don't even look in the mirror.
They don't, because they don't want to see.
Or by the time they look in that mirror, they don't recognize the face in it. You can go to a therapist weekly. It is no different than a diet plan. The things that you do have to be incorporated into your life. So these life situations that you have to do and have to deal with, because life throws things at us. We get busy, we got to work, we deal with our kids, we got to do all these things. But if we don't take the time and check in with ourselves daily, you can go to a therapist once a week and because it's an hour. So if you don't incorporate those things into your daily life, into your daily routine,
so Virginia,
the things not done on.
For those that may not know how to get in contact with certain therapists or the way to go back, does insurance pay for therapy?
Yes. So if you are, I always suggest clients look on the back of your insurance card. On the back of your insurance card, you can call the number on the back of. Some of them just say services. Some of them say mental and behavioral health. Call that number. Give them the criteria that you're looking for. Allow your insurance company to work for you. And ask them, what is it? Give them the criteria. Have them send you a list of therapists. Call them. And there's this thing, where people think that, I go to this therapist and it didn't work out. Everybody ain't gonna die. So I'm going to say, go to a therapist, give that therapist, sometimes you can tell them the first session if it's going to work or not. I say give it 3. If you ain't feeling it, if it ain't vibing, go to another one. When you try on one pair of shoes, you don't stop. Not especially if you're looking to buy new shoes. So keep going. Try out another one. Let's see how this one works out. But you have to first be honest with yourself about, you have to be ready for that. You really have to seek it out and go for it. You really do, because therapists don't fix it.
No,
That ain't what we do.
no.
Because we can give you the tools all day long, but if you don't use them, you don't use them.
Right.
But I'm gonna tell you what they say in NA and AA. Keep coming back. It works.
Yeah,
So keep going.
yeah.
Keep going. Your breakthrough. Yeah, keep going. So I'm gonna with your question. To answer your question, look on the back of your insurance card.
Yeah.
And so for those that may not have that, or like does the clinics and stuff like that offer? I'm just trying to, go across
So
the board to
Psychology
different
Today.
people.
Psychology Today has a list. So it's psychologytoday.com is where most of us post our profiles. You can key in your criteria. If you don't, you can tell if they take insurance, if they don't take insurance. The clinics, if you are struggling, if you are going to a doctor on a regular basis, say to your doctor, I'm overwhelmed. I am overwhelmed with everything that's going on with life, and I'm not sure if I'm depressed or not.
Right.
Coming from a therapist, I have been there. I went into my doctor and dealing with the death of my father before. It's that anticipatory grief that I was dealing with. I found myself working like a racehorse, working, like I was on it, working, doing everything. But I was not doing what I needed to do to deal with the emotions of his upcoming pending death. Because it don't feel right that I got to grieve somebody and they still living.
Right.
And so I talked to her about that, and we worked through it. I went on medication for a year, and this was before he passed.
And I think too, like even if you go to your doctor, let's say if you go to the clinic, wherever you go to the doctor, I do know a lot of times, and it may be when you go to the hospital, I'm not sure, but those are questions that they ask you when you come in. Or you feeling suicidal, or you feeling depressed, or you feeling sad. And I'm sure that if you answer those questions a certain way, then they will recommend somebody for you. Whether it's
Well, that's the fear.
Yeah.
See, that's the fear when
Nobody wanna
when
lay
when,
it
when
right.
you hear
Yeah,
certain.
Right.
And it's
They
like
wanna
I'm
be
on
Yeah.
this medicine.
crazy.
They're
Yeah.
just like,
Uh-huh.
I'm not going to
So-
tell the doctor.
But see, if you're sitting down in a private room and you say, I'm not sure when you haven't, have you been? First thing I know, most doctors walk in the room and be like, hey, how you doing?
Right.
And if you're honest with yourself, sometimes you be like, you know what? I ain't feeling it today. I'm not I don't know. I'm thinking I might need some help. But again, that's that vulnerability piece. That's that piece that scares us. That's that
Right.
thing.
And
Quietly,
and I get
privately,
that. Yeah.
you can look on the back of your insurance card.
And I get that not wanting to just say it when you're talking to your doctor, because even I had this situation when I went to the emergency room and they asked me certain questions, and when I answered those certain questions, the first thing they want to do is, okay, well, let's try this. They want to medicate your situation as opposed to actually helping you heal that situation. So I mean, and I get when people don't want to say certain things because they feel like it's gonna put them in a certain space.
But the medicine is the healing that
For
they
them,
feel,
for them, for them.
but
That's what.
Well, I'm gonna
that's
tell
what
you,
they feel.
sometimes medication is a whole nother topic. But I want you to know that sometimes you can't you can't help yourself sometimes without the medication.
Oh yeah, I get that too.
And because of the stigma, we can go back to the stigma, of what it is. Life does that to us. There's a stigma behind medication.
Right.
And if you're on it and if you're taking it and all these, things that are going on. And it is such a complex. You get what I'm saying? Mental health and breaking the stigma. Remember I talked at first about we're in this struggle to break the stigma. And this struggle, it's just that. We have to be able to push through it. And that means working out all of these fine lines, working out all of these details, having these conversations openly about it. So I commend you for having this conversation. Ladies, congratulations. You are on your path to working through and not just pushing through. Congratulations.
Thank you. Thank you.
And it just seemed like we talk, and then you look up and the hour is up.
Oh yeah, I know that.
And I know you work by hours, so I know that to be true. But I just wanted to, I really want to thank you for all of the information that you have given us, and just allowing it to be a conversation, and not, because when I talked to her, I wanted to know, like, are there questions that you want me to ask? Do you want me to have it this way or that way? And she was just like, no, we just just let it be.
And
a
that's the good thing about having the conversation, because it brings it more home. Like you at home with your home girls, or you sitting somewhere talking, and you actually find out more things, because then you're feeling comfortable enough to just pour out.
And
then this right here, this platform just makes it like we're conversating about real life issues that we're going through, or that we hear about people dealing with. And so if you guys have anything that you want to talk about, you can.
Yeah, and that's it. That is exactly what this is about. Just having conversations about life, whether it's a heavy conversation, whether it's talking about people in business, whatever it is. When it resonated in my spirit, it was just that. Sit at the table and have regular conversations. However, in the same breath, no matter what the conversation is, that is helping somebody in some way. Whether it's somebody that wants to open a business who thought they wouldn't. So I almost called you that other name.
She showed up. She showed up, didn't she? She showed up for a minute. But genuineness is what we have here. Just being able to genuinely, talk about your own struggles They will resonate with someone. They will put them in a place of understanding that they are not alone. Because a lot of times that's what we feel. We feel like we're in this all by ourselves, and we're not.
Yeah.
Okay. And I want people to know that it is absolutely okay. Okay to not be okay. What we want to do is start seeking what we need to get to a place of what we define as okay. Because right now, some people think they're okay.
Right.
And they truly do. Sometimes it takes a breakdown to build it back up. It's unfortunate that we have to go there, but we have to unlearn all those things that we thought were those things that got us through in order to be able to really rebuild. Sometimes it takes that. It's, again, unfortunate, but that's an individual path. Therapy is an individual journey that is not sometimes about rebuilding, but unlearning. Unlearning some of those old behaviors, unlearning some of those old thought processes, redefining words that, meant something or that were given to you, and redefining them for yourself through experience and, what you feel it is today. Because what your mama gave you ain't what it gotta be.
Right.
All right now.
That's it right there. And that right there, that what you just said, that resonates for me, and the things that I have going on in my life is not necessarily. I cannot expect my children to take the same path that I have on every level. That would be just like whatever my mother passed down to me. It's not necessary that I have to use everything that she gave me.
We have to evolve.
They don't have to use everything, and that's it. We have to evolve, and that is what I am learning.
That's what the microwave is meant to do. You see how the microwave evolves us? Your mom used to warm everything on the skillet, in the skillet on the stove, or in the oven. The microwave evolved us, and then comes along the darn air fryer. Hallelujah. All I'm saying is we just can add to it. It don't mean that what you use and what used to work don't work no
Right.
more. It
Yep.
just means that we have evolved to a place and enhanced where you started. Your foundation is there.
Yes.
One plus
That's
one
it.
gonna always equal two.
That's it. That's it. That's it. So, Virginia, if anyone wanted to know how to get in touch with you after the show, can you just give your information out? Um,
Well, the easiest way, and me and Nicole had this
Girl,
conversation the other
don't you
day.
say it.
And,
Don't.
and so the easiest way for you all to contact me again would be Psychology Today. My name is Virginia Eldridge, Eldridge. And you can, and boy, this is about to sound so awesome. You can Google me, baby.
I know that's
When-
right.
Right.
When she
Right.
said that to
Right.
me, when she said it to me, she had to laugh, and I think it's because we know each other. And when you tell somebody to Google you, it's
Right.
like she thinks she. But no, I
Yeah.
just laughed when I was like, "You are definitely right. I can Google you." So Virginia, I want to thank you for, and I know you
You are
wanted to
more
be
than
here, but
welcome.
you couldn't. So I
Yeah.
thank you for even being on the line and having this conversation with us. And we're gonna wrap it up, but I'm gonna let you go.
Thank you,
And
ladies, for having me.
Thank
Feeling
you.
the
Thank you for being a part. Awesome.
all right,
Yeah, that's your genuineness. Thank you so much for allowing yourselves to be a vessel. So
you
kudos to you all.
all right. Thank you.
Thank you.
You're welcome.
All right. Bye bye.
Hmm.
Well, I would like to say something. I just want to thank my mother and my granny because I am still blessed to be able to talk to them, and at this point in my life we can talk about anything. Like I feel like because life gets so rough, and it's like we feel like we have to things are off limit with people. Nothing is off limit. If you need to talk to somebody, talk to somebody if you can. If you need to just if you have to vent, please talk to somebody. Because that's the key to getting through life.
Yes.
And like I say, I'm very, very thankful and grateful that I still have my mother and my granny, and to sit and talk to them all day long. Like, it's no limit. We be on the phone for hours. So,
Especially with my mother.
yeah. So I just wanted to thank you all and just encourage everybody. If you need to talk, if you have something going on, reach out to a counselor. If you have someone in your life that you feel that you can talk to them, because that's very important. So just wanted to say thank you.
And that right there is raw and real conversations with Cole. And and this is how I want to end this, with us saying or expressing how we feel about things that are going on in our lives, because at the end of the day, people are just on the outside looking in. They assume that your life is one way when in actuality you are dealing with so many things.
Man.
But it's not even that you're trying to hide those things. It's just this is just how I wear my life. And to be able to have someone to talk to, then it's just, even if it's just like she said, to listen. If you can have somebody just to listen to you. So I'm gonna let Tanisa say, if it's something that she needs to say, then I'm gonna come back. We're gonna wrap it up. But I am so appreciative of them being here, because it's this topic. It's a difficult conversation to have. However, if you can have a conversation with anyone, then you should.
Okay. This is T. I'm going to just start out by saying this. I look okay. I sound okay. I get up and do my daily chores in life okay. but I'm not okay. Those that know me know that going on, I think it's 2 years where I experienced something very traumatic, is losing my mom. On top of that, I took care of her and I helped her prepare the end of her life. And if you have never been in that situation, it is so hard. I thought the strong T could do it. I did it, and I did it perfect, as perfect as I possibly could have. But the after effects of the trauma, and I'm truly traumatized. So even if I look away from certain things, I can envision her face. I can envision the way the cancer did her body, and to know. And I sometimes I sit and think, and I don't know if it's too graphic for you, but I literally watched that cancer eat my mother alive, pretty much, to her. And so now I sit and think how strong she was, steady laying there and fighting and pushing, and that pushes me like, okay, so get on up, because if she can do that and set that example, but at the same time, even having this conversation today, I know that I still have to not really let that go, because I can't go away. That's a part of me for the rest of whatever I have left. But the feelings and the emotions of that, I have to really find something to do with, because to make my mental health good. Like I said, I know how to do all the other things because that's repetitious for me. I've been working since I was 17. I've been taking care of kids since I was 18. I've been taking care of somebody, and I always took care of somebody in my family at one point in time. So it is time for me to figure out a way. I know how to dress up the outside, but it's really time for me to really get to this inside so that I can be more effective in the line of work that I'm doing and where I want to be at in life. So I thank you guys for listening to us today. I thank us for this conversation, because it is, and it's now the holidays are coming up. This is a stressful time for everybody, just all the things that's going on in the world with COVID, with the different jobs, the different families splitting up or coming together. It's just a lot of things going on, and just like they said, look at your friends. If you're around somebody, just ask them, are they okay? Because sometimes when you actually say that and they feel that coming from you, you'll find out that they're not. Not even if it's something long term, but some people, I think we all got caught up in that. Well, you don't want to ask that question because then they'll dump all their stuff on you, and you don't want nobody dumping all that. And then mentally, that person that needs to unload that stuff then heard the same thing, so they don't do it either. Or they'll feel like, well, I ain't finna tell them my business because they going to go and smash, go tell they go do this and go do that. So, I just think this now time in society where we really are, we all just need to come back to the drawing board and be more compassionate, show more empathy, like you said. And if it's people around you and most of the time the people that's around you that seemingly to be super strong, they not. Because it's hard to be super strong.
Right.
Now I just be like, look, this is what it is. Because, we all need each other.
Right.
We all need each
That's
other.
for sure.
We're going to leave it right there. We all need each other. We all need to do self-inventory daily, self-care daily. And I am happy that I am in a place to where I know how serious that self-inventory
I ain't even
is.
finished. Look, I got choked up. I didn't get to the point. Lost my sister, lost this, so I'm
Right.
all in a whole
Exactly.
whole
And
spot.
that grief itself is a whole nother
It's a
topic.
whole nother topic.
Because there's so many layers to grief, and it comes and it goes, and you
That's
just
what I say. Mental
never
illness
really
is
know.
like an
So
octopus. It
that's-
has
yeah.
so many different
Yeah,
tentacles
that's a
that
whole
comes
nother
off
level.
of that.
So we are going to wrap this awesome conversation up. And again, I am so grateful that Virginia decided that even with what she had going on, that she still wanted to be on and have the conversation. It helps because we're not professionals when it comes to mental health or depression or self-care. Some of those things we just feel like we know, but one thing I do know is that that's our opinions. Those are the opinions that we have. And so to have a professional to be able to just join in the conversation was awesome. I am so thankful that I had my daughter here to co-host with us today. and Tanissa here to co-host with me today. And we will be back next week with another topic. And the topic for next week is your ex. How do you co-parent or coexist with your ex even when you're moving forward in your life? What does that look
I'll be
like?
sitting at home for that.
What does
Me
that
too.
look like? And what does that look like for you?
We need 5 hours on that one.
So what does that look like for you? And again, I always thank you all for joining us on Conversations with Cole. And we will, honey, I done lost my train of thought. That is some real live stuff right there. Oh, yeah. So that's the conversation. That's the topic for next week. So, again, at the end, what
Hey,
y'all want
Roz.
to talk about?
And we're
All
gonna
right.
Is this the
celebrate
new
my
one that
birthday
you
too,
call?
y'all.
Huh?
Oh.
Okay. I'm gonna play this song because when I was thinking about not conversations with Cole, but just this topic, and just thinking about life itself, this song right here just resonated with me. So we're gonna let this song play us out, and hopefully, if you didn't get anything else from us, maybe this song will put you in another space. All right.